Yeah, good morning. Thanks, Nani and the panel for this good opportunity. Yeah, I mean, it's very interesting to see some of this good number mainly coming from Africa. And now let's move a bit in the region where we are sitting here in Southeast Asia, and particular from Vietnam, where International Livestock Research Institute, INRI, we are based and we are working in the country and the region. I would like just to add one point on the role of livestock. You see, the Africa context is very particular, and when you move to Southeast Asia and Vietnam in particular, you have very intensified livestock systems. For a country of 90 million people, we have basically 30 million pigs produced per year, and the meat consumption is mainly from pork. Most of Vietnamese eat pork in the country. And the important point to make is, in fact, most of this pork is produced by the smallholder. Basically, 80 to 90% of pork is produced by smallholders in Vietnam. And that actually leading to some challenges in managing the topic we talked today about zoonosis and AMR. I actually visited a CP farm during the Mahidol conference this year. And actually, they show us very nice farm, high level of biosecurity, and you see, it's very nice. And basically, CP in Thailand want to lead to zero antibiotics use in pig production. But when you look at the context of developing countries, this is not something that will happen very, very soon. You see, 90–80% of small farmers, they don't have this facility and mechanisms and facility to do on this thing. So I think that it's very challenging to see how we manage zoonotic disease and AMR in developing countries. So, however, we compare to Africa, I don't know in what context, but in Vietnam in particular, from the policy point of view, we see a lot of potential, and we can be optimistic in the sense that the government, they take up on this thing to develop on this national strategy and action plan to manage AMR and AMU in livestock and aquaculture sectors. So this is from the enabling environment is good, but the implementation, people always ask the question how we implement that at the ground level. So I think that in one of the another session on AMR, we discussed it and we try to make the point also that we need to generate more evidences from the economic point of view to really convince policymakers to take action on zoonotic disease and AMR in developing countries, because it's so crucial. This role of livestock play for the poor and for nutrition and food security and food safety in this country. You see, 10 million small households in Vietnam are involved in agriculture production, and 4 million households basically are producing pig. So this really is a huge asset from livelihood generation. So the government need to do something on that. But in another side, you cannot expect that the government do everything to control this thing. So from the research point of view, there's a lot of discussion now at the moment to go more in the implementation research. Generating evidences to advocate the policy, etc., is important at the same time. And in another hand, I think that we are really having to move to a phase where we have to do research to propose some of this actionable measure to control zoonotic disease and AMR in the country. You see some of the data from research showing that to produce 1 kilogram of live weight of pigs, Vietnamese farmers use basically the range of 200 to 500 milligram antibiotics. It's a lot compared to our Danish colleagues. They use only 50 milligram antibiotic to produce 1 kilogram of live pig weight. So I think that it's a really 10 times difference. And I think that the way forward is really to propose and give intervention on the incentive base, because you see the incentive is key for farmers. You see why they have to reduce antibiotics in crop promotion, etc., leading to the reduction of Nguyen, for example, and they cannot sell with this pigs with higher price. So the incentive have to be considered on this intervention. Good news for you is, in fact, our Ministry of Agriculture and Rural Development, and we have colleagues from DAH from Vietnam here, and Livestock Development Department. The regulation in Vietnam is, in fact, from 1st of January 2018, so 1 month ago. You are not allowed to add antibiotics in the feed as growth promotion measure. So it's very good thing. So, but I think that we need to go more on the intervention from the incentive-based approach. And finally, I want to make the point. This is my last point also. The One Health is important. To do that, you cannot do only from agriculture side. You need to involve other people from health and environmental sectors. And to implement this One Health approach in different countries, we need the capacity. And I'm glad to mention also that some of the initiatives happening for the last few years in Southeast Asia looks very promising. For example, from university point of view, you have the Southeast Asia One Health University Network. SIHUN actually is funded by USAID, where we teach students at medical, public health, and vet school about One Health. But we also go to the field to train professionals, people. From animal health level and preventive medicine level. So I mean, we need to tackle at different levels, not only from university, but also from ground level, where the activities is really happening. And I think that we need to do more in terms of capacity from different levels, combining the training and also the research. I think that the research is something missing in the regions, that we need to do more, generating more evidences and coming up with solutions for the small farmers. Thank you.